Okay, what is COVID-19? The novel coronavirus, or now most commonly known as the COVID-19, is an infectious disease caused by the most recently discovered coronavirus. This new virus and disease were unknown before the outbreak began in Wuhan, China in December 2019. COVID-19 is now a pandemic affecting many countries globally. How does COVID-19 spread? People can catch COVID-19 from others who have the virus. The disease spreads primarily from person to person through small droplets from nose or mouth, which are expelled when a person with COVID-19 cough, sneeze, or even speak. These droplets are relatively heavy, do not travel far, and quickly sink to the ground. People can catch COVID-19 if they breathe in these droplets from a person infected with the virus. This is why it is important to stay at least 1 meter away from others. These droplets can land on objects and surface around the person such as tables, doorknobs, and handrails. People can become infected by touching this object or surface, then touching their eyes, nose, or mouth. This is why it's important to wash your hands regularly with soap and water or clean with alcohol-based hand rub.
Symptoms of COVID 19. Most common are fever, dry cough, and tiredness. The less common are aches and pains, nasal congestion, headache, conjunctivitis, sore throat, diarrhea, loss of taste or smell, or a rash on the skin, or discoloration of fingers or toes. About 80% recover from COVID 19 without even needing to go to the hospital. Now, around 1 to every 5 people who gets COVID 19 becomes seriously ill and develops difficulty breathing. Older people and those with underlying medical problems like high blood pressure, heart and lung problems, diabetes, or cancer are at a higher risk of developing serious illnesses. However, anyone, and I do say anyone, can catch COVID 19 and become seriously ill. People of all ages who experience fever and or cough associated with the difficulty of breathing or shortness of breath, chest pain or pressure, or loss of speech or movement should seek medical help immediately. If possible, it is required or it is recommended to call the healthcare provider or facility first so that the patient can be directed to the right clinic. Do you know that COVID 19 and influenza are different? Though they do have some similarities. The similarities are such as they have similar disease presentation. That is, they both cause respiratory disease, which presents a wide range of illnesses from asymptomatic or mild through to severe disease and death. It is transmitted by contact, droplets, and formidas. As a result, the same public health measures, such as hand hygiene and good respiratory etiquette, such as coughing to your elbow or into a tissue, and immediately disposing of the tissue, are important actions that all should take to prevent infection. Now, for the differences, COVID has a longer median incubation period than influenza. Influenza has a shorter period. It also has COVID-19 also has a longer serial interval. Could say the opposite to influenza. And for COVID-19, the reproductive number is higher than influenza. Adults are mainly transmitting the COVID-19 virus, though for influenza, it is mostly transmitted by children. Now, for the mortality rate of COVID-19 appears higher than influenza. Influenza, we have like medicine to help lower the cause of death. So far those are the differences.
If you become ill, even with very mild symptoms, you must self-isolate. Even if you don't think you have been exposed to COVID-19 but develop symptoms, then self-isolate or monitor yourself. You are more likely to infect others in the early stage of the disease when you just have mild symptoms. Therefore, early self-isolation is very important. If you do not have symptoms but have been exposed to an infected person, self-quarantine for 40 days. And if you definitely have COVID-19 confirmed by a test, then self-isolate for 40 days even after symptoms have disappeared as a precautionary measure. It's not yet known exactly how long people remain infectious after they have recovered. Follow the advice on self-isolation.
We can protect ourselves and other people from COVID 19 by these few steps. One, we should all practice hand and respiratory hygiene. It is very, very, very important. It is the top priority for everyone. Washing your hands, sneezing or coughing into a tissue and directly throwing away are the few examples of it. Two, when possible, maintain at least a 1 meter distance between yourself and the others. This is especially important if you are standing by someone who is coughing or sneezing, since some people who are infected may not exhibit symptoms, or their symptoms may be mild. Maintaining a physical distance with everyone is a good idea if you're in an area where COVID-19 is circulating. Oh, and one more thing. I would like to tell you the differences between the three terms: self-isolation, self-quarantine, and also social distancing. Okay, first of all, let's talk about self-isolation. Self-isolation is when a person who is experiencing fever, cough, or other COVID-19 symptoms, they stay at home and do not go out to work, or if it was a child that got sick, to school or to public places. Usually, self-isolation can be done voluntarily by that person or based on the person's healthcare provider's recommendation. However, if you do live in an area with malaria or dengue fever, it is important that you do not ignore the symptoms of fever. If a person is in self-isolation, it is because that person is ill, but not severely ill that requires medical attention. And the you would say qualifications of self-isolation. You should have a large, well-ventilated place that has hand hygiene and toilet facilities. If this is not possible, you could place beds at least 1 meter apart, and you should keep at least 1 meter apart from others, even from your own family members. You should monitor your systems daily. Isolate for 14 days, even if you're feeling healthy, because remember, the incubation period of COVID-19 is around 14 days onto 1%. So, if you develop difficulty in breathing, do contact your healthcare provider immediately. Call them first if possible. And for the whole period of self-isolation, you should try and stay positive and energized by keeping in touch with loved ones by the phone or online, and by exercising yourself at home. So I just told you about self-isolation. Now let me differentiate the three terms that I said earlier, which are self-isolation, self-quarantine, and social distancing. Now, self-isolation means you are separating people who are ill with symptoms of COVID-19 and may be infectious to prevent the spread of the disease. For self-quarantine, it means restricting activities or separating people who are not ill themselves but may have exposed to COVID-19. The goal here is to prevent the spread of the disease at the time when people just develop symptoms. Usually, self-quarantine comes first in the whole thing, then self-isolation. Self-isolation is like, when people start to self-quarantine, they might see symptoms in themselves and they won't be able to spread the disease, something like that. So, third, social distancing. It means being physically apart from one another. The World Health Organization, or WHO, recommends at least keeping a 1 meter distance from other people. This is a general measure that everyone should take, even if they are not sick, with no known exposure to COVID-19, meaning that right here, even if you are sure that you're not you yourself are not exposed to COVID-19, but it's just as a safety measure. Remember, prevention is key. Prevention is better than cure. So yeah.